Hey everybody, it's Dr. Erinn Harris at Harris Internal Medicine. I am coming to you again to discuss vitiligo. We will address the elephant in the room. I know you guys may be thinking, or maybe not, I don't know, why am I so red? Why is my face so red and why do I look so red? Well, I stayed in my light treatments too long, or I stayed on one side too long. And so therefore, I kind of developed a sunburn. We'll talk about that later. I had planned on talking about autoimmune protocol like the food plan, but it seems that this is going to be my subject this week since I am so lobster red today. But let's talk about my progress, and let's kind of go over my progress a little bit. You guys can see that I'm filling in still. Still have some more fillings. I'll go ahead and take my glasses off and get closer to the camera. See. Okay, so you guys can pretty much see that on my forehead I'm filling in pretty well. You can see that I'm dotting up really well, and this space right here is all new, and it's starting to come over my eyebrows nicely. And it's filling in on this area around my eyes really well. This is starting to still fill in, come in. You can see my rims of my eyes are starting, it looks like I have eyeliner on, but it's just starting to kind of, this all used to be white, and so now you can start to see the melanin come in around my eyelids, which is cool, actually. Definitely see spots here, filling in here, filling in on my nose, filling in there. That's all new here because it's starting to kind of feel this way. On my chin, this all you can see, this is where everything started. Right here. It was like all white here. This is all new, filling in here. So it's kind of going down this way. And my ears are actually starting to fill in now. They're starting to come this way and fill in. So, excuse me. Pretty good progress, I think. So I can say definitely that what I'm doing is working. And I've done light treatments before. I've kind of told you I've done light treatments before, but when I did them, I would have good success with light treatments. But then, after about a year or 6 months, the color would go away. And that had a lot to do with the fact that it didn't stick because my diet and nutrients weren't there. I wasn't, I didn't have, I was eating all the foods that I was intolerant to. I was eating all the foods that cause inflammation, and I wasn't taking a good amount of supplements. And we'll talk about the autoimmune protocol, which is the diet that I'm on, and also talk about the nutrient, how important it is to get the nutrients that you need. But today we're going to talk about these light treatments. What there are two types of light treatments that you can use. The one that I use now is more prevalent. I started off, when I started light treatments, you guys heard me say I started off with UVA. You may hear PUVA. You may have heard of light treatments are for vitiligo. If you have had vitiligo for a long time, or just learned about vitiligo, or you have family members who have vitiligo, PUVA treatment was a big therapy even for patients with psoriasis also. Before there were a lot of biologics out there for psoriasis, they would treat people with PUVA. And PUVA is psoralen, that's the P in UVA, or the ultraviolet light A. So it's psoralen plus, the psoralen I know sounds like an S, but it's P, it's psoralen, it starts with a P. So it's psoralen plus UVA light treatments. And you would take this medication called oxorelin, and you would take it a couple of minutes, not a couple of minutes, I'm sorry, about 30 minutes or to an hour before you get your light treatments. And it would make you more sensitive to light. And then you would get in your light treatments and stay in there and do that 3 times a week. Later on, as time progressed and medical care, of course, became more technical and more advanced, we started doing UVB light treatments, specifically not just wide band UVB, but narrow band UVB. So that means they're taking a specific wavelength of UVB light, and these light bulbs have this just specific wavelengths, and it's between 311, sometimes 310, but usually 311 and 313 nanometers. So that's the wavelength that they use of light treatments. And so, and it's kind of like focused light, and it hits right where your skin needs it to hit, and it takes, it doesn't cause as much damage sometimes. It's more effective and got results a little bit faster, and actually didn't cause as much damage with the light treatments. So that's just about it. You usually do light treatments about 3 times a week. You go up in power, I would say every week, as long as you can tolerate it. You go, not up in power, I'm sorry, up in wattage. So you may just stay there a little bit longer. They may increase the wattage. Most of the time, your time just increases. So because the wattage comes from the light, so your time just increases. So you may start off with 30 seconds your first week, and then go up for every treatment. And every treatment you go up to a minute, and the next treatment you go up to a minute and a half, all the way up to sometimes 5 to 10 minutes, depending on how tolerant you are of the light. So if you ever become red, definitely you need to go ahead and start the light treatments, and wait till your skin cools off, and wait till the redness goes away or the peak goes away before you restart the light treatment. So, of course, in my story, I have a lot of uptime. I'm really busy, and so light treatments tend to be my downtime. And I was just there, doing my little light treatment, and forgot to turn over. I have the type of UVB light treatment that is just flat on one side. So when the time is up for one side, I have to flip over like a pancake or a hamburger, and then do the back side. So this time I was just, sitting there and sitting in front of the front, and then it felt a little sting, and I forgot to flip over, in a sense. So that's how I got burned. So if you do have redness, or if you do have a lot of problems where you burn with the light treatments, you need to either take it slow or cut back. Now, I'm not telling you to do this kind of like on your own. I am telling you, definitely do this under the guidance of an experienced dermatologist or physician who knows what they're doing. So definitely don't do this just get a light box. Actually, if you do get a UVB treatment, or a light, what we call a light box, if you get something like that, it has to be, if you're not a physician, you have to get a prescription for it if you want to do it at home. But the great things about the UVB treatment is, before, we would have to go to the doctor. We would have to go to, even I had to go to a physician's office 3 times a week, and that took time out of my schedule. And I was like, I had to make time for it, and if I didn't have time to do it, then I wouldn't get the light treatments. The beauty of things now is you can get light treatments at home. You can order UVB light treatments, and they're expensive, but if your insurance may cover them, if your insurance covers the light, the UVB box, then that's great. So usually you can get a prescription from your dermatologist, and they can prescribe you and show you how to do that at home, and you can do that 3 times a week at home, which is definitely more convenient, definitely more effective, I think, because you can kind of do it at your own leisure. So that is something that you want to consider. But of course, if you have that done, you need to make sure you're always following up with your physician to make sure everything's okay. If you're under treatments under light treatments under the direction of your dermatologist. All right. So I don't think there is anything much more. If you guys have any other questions about light treatments, I know I can't, because we have this whole thing with good for kids, or it's suitable for kids. You guys can make comments, but you can always go to my Facebook page, or you can go, you can give us a call or something like that if you have any comments or questions about UV light treatments, or you can just follow up your local dermatologist and ask them, to start UVB. So, again, that's a very effective way. You need sunlight in order to start producing melanin cells, and there's kind of like an immune suppression that happens when you do UVB light treatments. It suppresses the immune system at the skin level, not only to you know, whatever's going on immune rise to calm that down. Remember, we kind of talked about that. An autoimmune system is your system going, and you need to calm that down. But also, it stimulates your melanin cells to produce melanin. So, very effective along with diet, nutrients, exercise, everything that is great and wonderful about being healthy. So, you guys, I will see you guys next week, and we'll go ahead and see what's new on my skin. And also, I think next week we will talk about the autoimmune protocol, because that kind of leads into treatment of vitiligo, not just what vitiligo is all about, but how do you treat it? You know, what are some things that you can do to treat vitiligo? It's not untreatable. As you can see, if you guys go back to my first video, episode 1, and go now, you can definitely see that this is not an untreatable disease or disorder. Okay, so see you guys next week. You guys have a great week, and don't stay out in the sun. If you do, of course, if you just have vitiligo and you're not being treated, make sure you use sunscreen. All right, you guys have a good day. Bye.